Through a collaborative partnership with Hope Hospice, Shell Point has provided hospice services across the continuum of care since 2002. Located on the 4th floor of the Larson Pavilion Skilled Nursing Center, Shell Point's 9-bed general inpatient hospice unit offers both symptom management and end-of-life care in a beautiful waterfront setting. Shell Point's medical director, Dr. Roger Herchak, speaks with marketing and communications director Lynn Schneider about the decision to bring hospice to Shell Point.
About 15 years ago, Lynn, the president and I got together and talked about hospice services for Shell Point. About the only service we did not have at Shell Point was hospice. And at that time, President Peter Dice said we should have hospice services at the end of life, or if someone is hospice served and they're in need of pain and symptom management, why would we want to send them to another location? Our job is to keep our residents here at Shell Point. So 15 years ago, Mr. Dice and I met with the CEO and president of Hope Hospice, Samara Beckwith, and said, how could we make Shell Point another site for Hope Hospice with a blending of staff? So after a number of other meetings, we made it happen. So in July, it'll be 15 years that we opened our hospice unit. And we were fortunate at the time, Lynn, because the annex had just been completed on the 4th floor. And that floor had 9 private rooms with the most pristine views over the island and over the lagoon. And I said to Mr. Dice, could this be our location? And he was gracious enough to say yes. So in conjunction with Hope Hospice and our staff, we had a blending of staff and we opened up our hospice unit.
Samara Beckwith, President and CEO of Hope Healthcare and Hope Hospice, talks about the importance of hospice and their relationship with Shell Point.
It has been our pleasure to have such a positive relationship with Shell Point. And over the years, in fact, even in the beginning years when I first came to the community, I came and met with the administrators at Shell Point, and we talked about how to better serve the residents and decided that it was best to keep people as close to home as possible. And because we wanted to do that, we were able to establish, I really believe, a unique relationship and a unique opportunity to have Hope Hospice at Shell Point and establish the special unit that we have there, as well as caring for people in their own independent living or assisted living or skilled nursing facility.
Dr. Herchak clears up some misconceptions about hospice care.
One of the misconceptions, Lynn, is that hospice is a place for people to go to die. You go into a hospice unit, for example, that we have on the 4th floor, you get plugged into a morphine infusion and you die. And that is so far from the truth. If you qualify for hospice with a diagnosis, it may be a cancer diagnosis, cardiovascular diagnosis, end-stage dementia diagnosis, and a provider, physician or nurse practitioner feel that you have 7 months or less to live, you would qualify for hospice services. So I always say you lose nothing, but you gain everything, because you get to keep your primary care doctor, you get to keep your ancillary services, but hospice will supply you with medications that are related to your hospice diagnosis. You will get access to an RN, a number of other services, chaplain services.
And now that I'm the Director of Spiritual Services, I have the opportunity to follow them from the time they come in, live here for long-term care, or in the dementia unit, and they've become like family to me. So when they come to hospice care, since I've had a little bit of a history with them, I have the privilege of being able to kind of be with them until the last breath, which is to me a really wonderful thing.
Sunny Torres, the Director of Spiritual Services, stresses the importance of helping patients and their families during and after their hospice stay.
It's an important part of their lives, the spiritual side of things. And even though death is a very physical thing, it's where your soul and your body have to make the split. And for them, they just need encouragement that that they're going to be okay.
But it's not always a one-way street when you get into the hospice unit. In order to qualify, someone could be hospice served, but yet they may not see me in a GIP unit. That floor is like the intensive care unit of a hospital. If one's symptoms cannot be managed at another lower level of care, and that could be chronic nausea, pain, restlessness, shortness of breath, and then you qualify to come up temporarily to the GIP unit, into that intensive care unit, where they're seen by a doctor every day, and they get intensive care. So not everyone that goes to the GIP unit is there for a one-way stay. We very often discharge people back to their homes.
I really believe that hospice care at Shell Point is so special because both organizations want the best care possible for the people that we serve. And because of that, both organizations, the staff, all work together, and the volunteers, to be sure that the care is the best possible.